so coming to our topic, we'll be starting with a basic small introduction of the face, and then we'll hop into the topic. Okay. Firstly, we'll discuss the landmarks of a face. The face is basically it is got extension from the hairline above to the chin and the lower border of the mandible below, and laterally it is bounded by the auricles. Okay. Face has got some characteristic features which are as follows. Firstly, face has got the skin of the face. It is highly elastic and has got a very high, rich amount of vascular supply, and hence this results in the good healing of the like good wound healing in cases that if there is any sort of injury present in a face. Then there's a good amount of fat layer present, which is utilized by the cosmetic surgeons for any sort of cosmetic surgery. The skin is also very lax or loose. So if there's any sort of injury occurring in the face, there's a presence of a huge amount of swelling or bulge in a face. Why is it so? Because the skin is lax. And lastly, the muscles of facial expressions are inserted into the skin of the face. Okay. Now we'll be dealing with we'll hop into the main topic of our discussion today, the muscles of facial expressions. Okay, the muscles of facial expressions, it has got certain characteristic features which are very important from the dental point of examination as well as wider point of view. Firstly, the origin is from the facial bones, but the insertion is into the skin. Okay, now for all the first years out there, for all the freshers out there, do remember, doctors, a very important topic, a very important point is that when it comes to any sort of muscle that is present in our body, the origin is almost and everywhere fixed, whereas the insertion is movable. Okay, why is the origin is always fixed? Because it originates from the bone and it inserts into into the skin or into any organ or sort of thing. Okay, so this is really very important to remember this point. Like where once you start practicing, once you'll be in frequent practice with all the muscles of our uh, mainly our focus is on the muscles of our head and neck. So you'll get thorough with this point. But when it comes to a first year student, there's so many things to remember. So this is quite confusing. So just to make your concept clear, always and always remember the origin is always fixed, whereas the insertion is always movable. Secondly, this point is quite important that the muscles of facial expressions, they are derived from the second pharyngeal arch. Okay, why is it important? Because this is important from the viva point of view, as well as you should know this point. Like this is quite important. Pharyngeal arches are the one which gives origin to each and every body part. So yeah, this point should be very clear in your mind that the muscles, they are derived from the second pharyngeal arch. Okay, and this is the last and the important point. The muscles of facial expression, they all are supplied by facial nerve. There are certain muscles which are also supplied by other nerves as well, but most of them are supplied by the facial nerve. Okay, now the muscles, they are divided into three categories. Firstly, the muscles around the orbit. Secondly, the muscles around the nose. And third, but last but not the least, the muscles around the oral fascia. Okay, so I'll explain it to you with the help of a diagram. We'll deal like the muscles, they are divided in three categories. Firstly, the muscles around the orbit. Secondly, the muscles around the nose. And last but not the least, the muscles around the oral cavity or the oral fascia. Okay, so in today's lecture, we'll be dealing with mainly two parts, that is muscles around the orbit and muscles around the nose. And in the coming consecutive lectures, we'll be dealing with the remaining part. So let us begin. The muscles around the orbit. Okay, the muscles around the orbit, they are further classified into two main categories, the constrictor one and the dilator one. Constrictor muscles are the one which are responsible, as the name specifies, they are responsible for the constriction, whereas when it comes to the dilator muscle, they are responsible for the dilatation. Okay, now, constrictor muscle has got one group of muscle, that is orbicularis oculi, and the dilator muscles have got three groups of muscle. Now, a very important point to remember here is that most of the first years out there, they get confused between, because there's one more muscle which is got similar name, orbicularis oris. So there's quite confusion कि यार orbicularis oculi कहाँ पे है और orbicularis oris कहाँ पे है. तो ये चीज याद रखने के लिए oculi is equals to I. So oculi will always be present around the orbit. Okay, ये point याद रखना है. Orbicularis oculi, oculi is equals to I. So oculi is always present inside the orbit, in the orbit. Now coming to the dilator muscle, they are three in number. Just to remember the dilator muscle, remember CFL. Okay, CFL, whenever a CFL bulb is lightened up, it causes, जो अगर हम किसी बंद कमरे में बैठे हुए हैं, अंधेरे कमरे में बैठे हैं, CFL का बल्ब जलेगा तो आंखें हमारी तुरंत बंद होंगी. ठीक है, तो CFL जलेगा तो आंखों पे असर पड़ेगी. ये चीज आपको ध्यान रखना है. So CFL stands for, C stands for corrugator supercilia, F stands for frontalis, and L stands for levator palpebral superioris. Okay, so now let us begin with the constrictor muscle. Constrictor muscle has one group of muscle, that is orbicularis oris, which has got a very important function of the constriction of eye. Now, orbicularis oris has got mainly three parts, okay? The orbital part, the palpebral part, and the lacrimal part. This is an image of the function of orbicularis oris, as I've specified that this group of muscle comes under the constriction group of muscle. This muscle is a constriction group of muscle. So you can clearly see and appreciate it from the image, like the child has closed his eyes due to bright sunlight or whatever the reason is. So the function of constriction is very well appreciated in this diagram. Before we jump into the main topic, I would like to make this a note that we'll be dealing the topics, like all the muscles are dealt in mainly four headings: the origin, the insertion, the nerve supply, and the action. Okay, this is quite an important topic which every first year out there need to remember. The muscles we'll be dealing with mainly in four topics: the origin, the insertion, the nerve supply, and the action. Okay, now we'll begin with the orbital part of the orbicularis oris. The orbital part, it originates from the medial palpebral fibers, which is from the maxillary process of the frontal bone. And the fiber sweeps around the margins of the eye in a C-shaped manner and inserts into the medial palpebral ligament from the frontal process of the maxillary bone. Okay, this might be quite confusing for the first years out there, so let me clear it to you. As I said, the muscle, the orbital part, it originates from the medial palpebral fibers, which are located somewhere here. Medial palpebral fibers, which originates from the maxillary process of the frontal bone. Okay, what do we mean by maxillary process of frontal bone? This is what we call as maxillary process of frontal bone. So the fibers originates from the medial palpebral fibers from the maxillary process of frontal bone. The fiber sweeps around in a C-shaped manners around the orbit. The fibers, they sweep around in a C-shaped manner around the orbit and inserts into the medial palpebral ligament from the frontal process of maxillary bone. Now, this is the frontal process of maxillary bone. Okay, people might get confused that like I have been telling you that it originates from this place as well as it is inserting in the same place. Yes, it is originating and inserting into the same place, but it is originating from a ligament, and it is originating from the fibers and is inserting into a ligament. Firstly, secondly, the medial palpebral fibers, they are basically originating from the maxillary process of frontal bone, whereas the medial palpebral ligament is originating from the frontal process of maxillary bone. Okay, you need to remember this point. Now, nerve supply, as I had told it earlier, the nerve supply will be the facial nerve. And what is the function? The function is forceful closure of the eye, as in right sunlight. You can appreciate the forceful closure of the eye in this diagram. It is well appreciated. Now, coming next to the palpebral part. The palpebral part, it lies mainly in the eyelids. Okay, it lies mainly in the eyelids. The origin is medial palpebral ligaments and insertion is the lateral palpebral rapid. Okay, the origin is medial palpebral ligament and insertion is into the lateral palpebral raphe. Okay, the nerve supply is again facial nerve. The action is gentle closure of the eye, as we can appreciate it from the image below. Now coming to the lacrimal part, it is basically an extension of the palpebral part. The origin is deep to the lacrimal sac and it ends at the posterior lacrimal crest. Okay, now I cannot show you this thing in the diagrammatic way because I couldn't find such images which could like very well appreciate the origin and insertion of the lacrimal part. But in this case, you need to kind of imagine this thing that the origin is deeply lacrimal sac and it ends at the posterior lacrimal crest. Okay, and what is the main function of the lacrimal part? The lacrimal part is mainly responsible for the drainage of tears. It dilates lacrimal sac and helps in the tears pouring out, as you can appreciate it in the image. Now coming to the dilator muscles. As I've told you, dilator muscles, they are of three types, and the mnemonic that I told you was CFL. Okay, CFL is the mnemonic that you have to remember. C stands for corrugator supercilii, F stands for frontalis, and L stands for levator palpebral superciliaris. Okay. Now, corrugator supercilii. Corrugator supercilii का origin क्या है? It originates from the median end of the superciliary arch. The median end of the superciliary arch, and inserts into the skin just above the mid part of supraorbital margin. ये हमारा supraorbital margin आता है जहाँ पर हमारी eyebrows होती हैं. इसको हम लोग तीन पार्ट्स में डिवाइड कर लेते हैं, मीडियल, मिडल एंड लेटरल. सो जो हमारा मिडल पार्ट है, जो मिड पार्ट है, उसकी स्किन के ऊपर ये इंसर्ट करता है. एंड ओरिजिनेट कहाँ पर से करता है? हमारी सुपरसिलियरी आर्च. सुपरसिलियरी आर्च हमारा इस जगह में कहीं पर लोकेटेड होता है. व्हेन इट कम्स टू द बोनी लैंडमार्क, इस जगह पे कहीं पर लोकेटेड होता है. ओके, I'll show it to you in a diagrammatic presentation. You can very well appreciate. See, it originates from the medial end of the superciliary arch and inserts in somewhere in the mid part of the supraorbital skin, just above the mid part of the supraorbital margin. Okay. Now, what is the nerve supply? The nerve supply is again facial nerve. And what does this muscle does is it causes the vertical creases in forehead as in frowning. You can appreciate it in this diagram, or I should be more specify in this. This diagram could be more specific. You can appreciate few lines are being formed in this region. This is formed mainly because of the presence of corrugator supercilia. Okay, corrugator supercilia is responsible for this frowning expression present in this child's face. Okay, the frowning, the vertical lines which is caused in the glabellar region or in the forehead region is caused because of some other muscle, which we'll be dealing in further slides. But the frowning, like it is a combined action of both the muscles. So for the present moment, you just remember that the vertical creases is caused by the corrugator supercilia in forehead. Okay. Now coming next to the frontalis muscle. The frontalis muscle, it originates from the skin of the eyelids and the skin of the root of the nose. Okay, it is got the origin is from the skin of the eyelids and the skin of the root of the nose, somewhere here. Okay, you can appreciate it. We'll appreciate the diagram, and then it inserts into the galea aponeurotica. Now, what is the nerve supply? The nerve supply is the temporal branch of facial nerve. See, again here the nerve supply is facial nerve. But when it comes to frontalis, it has got a specific branch of facial nerve, that is the temporal branch. When it comes to the other muscles, the nerve supply is facial nerve simply. But when it comes to the frontalis, the nerve supply is temporal branch of facial nerve. Now, what does this muscle causes? It causes transverse creases in forehead. Now, we can appreciate it from the image above. Like in this diagram, there's no tension or any sort of expression present in the person's face. So, there is no lines present. Now, when it comes to any sort of like the person raises the corner of the eyebrow as it is specified in this diagram, this is appreciated in this diagram, it causes transverse creases in the forehead of the person. Okay, which muscle is basically responsible? You can appreciate it like once the person raises his or her eyebrows, The muscles pauses, transverse squeezes in the forehead. Now coming to the levator palpebrae superioris, the levator palpebrae superioris, it originates from the inferior surface of lesser wing of sphenoid, and it inserts into the superior tarsal plate and skin of upper eyelid. See, you can appreciate this is the lesser wing of sphenoid, and it originates from the inferior surface of the lesser wing of sphenoid. This is what we call this inferior wing, and it originates from the inferior surface of the lesser wing of sphenoid, and it inserts into the skin of the upper eyelid and the tarsal plate. Okay, it inserts into the skin of the upper eyelid and the tarsal plate. What is the nerve supply? The superior. See, I've told you this thing in the very beginning that majority of the muscles of facial expressions, they are supplied by the facial nerve, but there are certain muscles which are also supplied with different nerves. So levator palpebrae superioris is one of these examples, which is supplied by the superior division of oculomotor nerve. This isn't supplied by the facial nerve, but it is supplied by the oculomotor nerve, that to the superior division. So do remember this point that levator palpebrae superioris doesn't have a facial nerve supply, but it has a oculomotor nerve supply, and that to the superior division. Now, what is the action? The action is elevation of upper eyelids. You can appreciate it from the diagram. The upper eyelid is being elevated. So, the elevation of upper eyelid is done by the levator palpebrae superioris. Now, coming to the muscles which are around the nose, they are basically three in number: the procerus, the septi, and nasalis. So, what is the mnemonic which you can remember this muscle is please don't sleep now. Okay, you guys might find these mnemonics quite funny or quite weird, but I'm telling you, these mnemonics help us out throughout life to remember these muscles. Okay, we have been taught these mnemonics by our teachers in first year, and till date we remember these muscles very well. We are very well versed with these muscles. Why? Because we were taught in a very easy way with the help of such mnemonics, which were actually quite funny and easy to remember. Okay, anatomy isn't a tough subject to remember. It's funny and interesting if you do it in an interesting way. Okay, now how can you remember this mnemonic? Please don't sleep now is like whenever you yawn or whenever you open your mouth or open your mouth for yawning, you feel like your nostrils get dilated. Okay, there's wide opening in your nostrils. So whenever you yawn or whenever you you are present in like you causes any sort of anger or any sort of frowning sort of thing, so your nostrils got expanded. So in that case, the muscles around the nose comes into action. So you need to remember, please don't sleep now, and while you sleep, whenever you feel sleepy, you yawn. So just remember this mnemonic, and you'll remember this is Procerus. P stands for Procerus, septi, don't sleep, BS, and nasalis, nothing. Now we jump to the topic. Yeah, just give me a sec, I guess. Sorry, there was some trouble causing between. Yeah, so let us continue. Now, firstly, yeah, you can appreciate it from this diagram. It is showing all the three muscles. That's the procerus, then the nasalis, and the depressive septi. Okay. Now, let us begin with the procerus. Procerus, the origin is from the nasal bone and insertion is into the forehead. It is supplied by facial nerve and it causes transverse wrinkles over the bridge of the nose, helps to reduce the glare of bright light and expresses frowning. Okay. You remember while I was discussing corrugator supercilia, I told you that the muscle is responsible for frowning in this area, whereas there's another group of muscle which is responsible for the frowning or the vertical lines in the glabella area or in the forehead area. So, procerus is the muscle which is responsible for the transverse wrinkles over the bridge of the nose or to express frowning. Okay, so procerus along with the corrugated supercilii causes the complete action or the complete expression of frowning. Okay, another function of this muscle is, as you can see, it is responsible to reduce the glare of bright light. You can appreciate it from this image that the person is trying to close his or her eye because there is some bright light coming right from front. So yeah, procerus is also responsible for reducing the glare of bright light, and yes, as specified earlier, it is also responsible for causing the expression of frown. What is the origin? The origin is from the nasal bone and the insertion is into the forehead. Okay, you can see very well the image and you can appreciate it with the help of the diagram. The origin is from the nasal bone and insertion is into the forehead. Now coming next to the repressive septi, the origin is from the incisive fossa of the maxilla, which is present inside the oral cavity, and it is inserts into the lower part of the nasal septum. Like below this cartilage region of our nose, there is a nasal septum present. You must have read about it. It inserts into the lower part of the nasal septum. What is the nerve supply? The nerve supply is buccal branch of the facial. See, now facial nerve is supplying, but to be more precise and specific, the buccal branch is mainly supplying the depressive septum. What is the action that this muscle does is it causes depression of nasal septum and widens the nasal aperture. You can appreciate it from this image. What is the action of depressive septi? This is the depression of the nasal septum, okay, and it widens the nasal aperture. This is what the image is, and with this image you can remember, like I told you, the specific mnemonic for all the muscles around the nose. Please don't sleep now. This was the reason I was telling you. Whenever you like make such sort of faces or you yawn, mainly this muscles comes into action. There's depression of the nasal septi as well as there is widening of the nasal aperture. So the muscles around the nose are responsible for it. See, you can appreciate it from the diagram. It originates from the incisive fossa of the maxilla and it inserts into the lower part of the nasal septum. Okay. Coming next to the nasalis muscle. Nasalis muscle basically it goes two parts, the compressor nares and dilator nares. Okay, you can appreciate it from the diagram. It is present laterally around the bridge of the nose. Now, the compressor nares, it arises from near the maxillary notch and inserts into the bridge of the nose. It originates somewhere from here and it inserts into the bridge of the nose. The facial nerve is the nerve supply and it causes, what is the action? It causes, compresses the nose. Dilator nares, it originates from the maxillary notch and it inserts into the ala of the nose. Again, it originates somewhere from here and it inserts into the ala of the nose. This is what is the origin and insertion of dilator nares. The facial nerve is the nerve supply for both the muscles. Dilator nares, as the name specifies, compressor nares compresses the nose and dilator nares dilates the ala of the nose. Okay, now I couldn't find any specific diagram for the action of nasalis muscle, so you again need to quite imagine this point of mine that the compressor nares it compresses the nose, whereas the dilator nares it dilates the ala of the nose. So here are my sources which I have taken all the information from. You can go through these books and find more in detail about all the muscles. And we'll be dealing with the muscles around the orbit, or the muscles around the oral fissure in next part. And there'll be much more to cover in the upcoming slides. So yeah, we are done with the today's lecture. Thank you. Hope you enjoyed.